Yeah, two of them are here, and also the staff, the colleagues in the hospital are here. They're all working together to make sure that this program works. And the program is working because now we have 9 students. Congratulations to you all for passing your exams. And you are now in your 4th year, right? 5th year. So in the next 2 years, you'll be graduating. Isn't that going to be a great achievement? It will be a great achievement for this country. And after you, we have a cohort of about 16 people, right? Following your footsteps. So we are all looking for that great day. And we want to encourage you all to continue your studies because it's going to be an exciting time for you in your career. I can assure you that. As I said, it is working. Now as you can see, the dental school is being built, of course, and hopefully it will soon be completed. And it will be another great achievement. And also, we have all the materials that we should have for the next clinical years. So they're all here. And now it's just for us to work together to make sure this comes to reality. But before I sit down, let me also thank Professor Jafari because, without their support, we cannot get the program going. Thank you, Professor Jafari, for sharing your interest and your collaboration and to help us with the little small, but it can be large obstacles. But we thank you for your support. And I want to let me thank my other colleagues here, starting from Dr. Sangbedu, as I've said before, at one time he was the CMD. Thank Dr. Gray Johnson there, Associate Professor Cyril, and Associate Professor Akindayo, and all the other members of the team who are here. This is a great day, and I want you to be happy about it. I want you to be glad about it, and let us go out and give the message that we can make a difference, and we look forward to you all working as a team to achieve that. Thank you very much.
Please let's join our hands together as we welcome the CMD Professor Al-Jafari.
Sir George, and all my colleagues, Prof. Pamela, the former CMD, all the students, all the staff of Edward Francis Small Teaching Hospital and University. Maybe it's a big surprise to me that to give statement, nobody informed me before, but I want to say that I'm very happy to be with you today to celebrate this oral day. Maybe as hospital, I'm sorry, sometimes we don't give the full support to the dental and oral for that because we have plenty problem at the hospital, but this is not excuse. As CMD, I promise you from now, we need to focus between the hospital, the main services and the oral services, because all these services reflects to the patient. So I am very happy, Dr. George, I promise you, I would do my best to support the dental clinic, to support the oral health, to support what you advise me, I will do on beside of the hospital. So from now, I think we need to celebrate all of us with this day. You know, the hospital, to run hospital like Edward Francis Small Teaching Hospital is not easy as a major referral hospital in the country. But at least we need to do something from today for the dental, especially we are going to have dental school. It's like medical school. So there is now this big achievement for the government of Gambia and this big achievement for Dr. George, to be honest. He pushed for a long time to have this, and I think we need to thank him about this great achievement. Nobody know what the meaning to establish dental school. He fighted for a long time to have this achievement, and inshallah very soon you will see the building finish and you will see the student and the cohort like the medical school. So again, thank you all the high table, all of you to join this ceremony. Thank you for all of you. As I say, as I promise, from today, I will put plan to support all the dental clinic and to make sure that happy mouse and healthy body is very important, like any other sector. Thank you so much. Thank you.
So as we make progress in the in this media engagement event, the next item on the program is who we are. So remember, I told you that I'll be wearing various caps. So I'm wearing the cap now of a presenter. So I'll be talking to us about who we are. So fortunately, our leader and head facilitator has given us an overview of how we got here. But I'm going to try to give us a breakdown of how we got here and where we are going. So briefly, I'm just going to welcome everyone. So this program is organized by dental practitioners and UTG dental students. And but before I go ahead, I'd like to inform to enlighten us a little bit about the UTG dental surgery program. So basically what I'll be doing is to go a little bit in depth into what Dr. Melvin George had told us earlier. So the training of highly skilled dental surgeons for the Gambia was initiated by the Office of the Facilitator of the Undergraduate Dental Program, the School of Medicine and Allied Health Sciences, University of the Gambia, under the leadership of Dr. Melvin George. The program was established by an Act of Parliament in 2019 and admitted its first set of students in 2020. And this project enjoys approval and support of the Vice Chancellors, past and present, Vice Chancellor of the University of the Gambia, as well as acting provost, past and present, the CMDs, past and present. They have all been very supportive of this program, and that is how and why we have come thus this far. So what is the justification for this dental surgery program, and how do we link it to the oral disease burden in the Gambia? So the need to commence this program was very necessary, because there's a dearth in the number of dental surgeons in the Gambian nation. If we, despite the overwhelming presence of oral disease, and globally, like Dr. George said, oral diseases constitute a major public health problem, and that burden is enormous. In fact, it's said like 44%, which is almost like 50% of the population of the entire world suffer from a form of oral disease or the other. I'm sure if we all look into ourselves now, most of us would have had one complaint or the other of toothache or any other oral disease. So it is there, it's prevalent amongst that. You have almost half of the entire population suffering from one form of dental disease or the other. So, and this burden is significantly more on the underprivileged and disadvantaged population. So where you have people that are with low socioeconomic status, then the burden is usually more on them. But the sad thing, and these diseases at times, in some instances, lead to death. But sadly, the sad thing is that these diseases, a number of them, an appreciable percentage of them, are preventable just by keeping by oral health education, the instructions. We're able to prevent many of these diseases and prevent unnecessary death. So the factors that will contribute to this burden include poverty. So anywhere there's poverty, illiteracy, poor oral health hygiene practices, lack of access to affordable oral services. Some people don't know where to go. They don't ask. They don't know. They have the information on where best to go and have their dental treatment done. Also, where we have weak national oral health programs. Generally oral health is neglected. It's not only here, but worldwide. Oral health is neglected worldwide, particularly where you have us. I won't say competing with other health challenges like malaria, tuberculosis, maternal and child health. So most of the time, those things will take priority, and oral health will be kicked to the background. But what we are saying is that a vast majority of people are suffering from oral health diseases. So we should be able to encourage that these things are done side by side. As we are paying attention to all these other ones, then oral health also deserves the attention that it needs. Then we also have greater inequitable distribution of dental professionals. Those in the rural areas suffer more because they don't have these facilities, and those of us in the urban areas have easier access to oral health. So these diseases require specialized training. Now, I learned a few days from a colleague that dental education, oral health education, is a profession, is not a trade. Many of our people treat it like a trade, that you just go under somebody 2 or 3 months, you want to learn how to extract teeth, you want to learn how to, but is a each of the specialties in dentistry and each of the subdivisions in dentistry. To be a dental nurse, there's a process for it. To be a dentist, there's a process for it, and they are all professional courses, and they are not just trade that we could just learn by the side or in the market or something. So I stand at present, for example, in a nation of I understand the population of Gambia is below 2 million. I believe so, and at present, I'm not sure. I don't have the exact figures, but at present we have just about 5 expatriates that are providing dental health services in the public hospital. The Edward Francis Small Teaching Hospital Polyclinic is the biggest facility where patients come for oral health care, and we just have about like 5 expatriates. And also, when we look at the private practices, also we also maybe they are just a handful. They may be less than 15 or 20 thereabouts. But most of these private practices are also run by expatriates, and we know that for the underprivileged, they are not able to go to such places to have their treatment done. So that is also a problem. Now, if we think that perhaps government has supported training of dental health practitioners outside the country, and perhaps we are just waiting for them to graduate from wherever they are and they bring them in to show up the numbers, then that also, I don't think we have a policy whereby maybe we'll send people out to go and train and come back and help us increase the numbers of dental health practitioners. So it's also unlikely that and it's also unlikely that perhaps we have some people in the diaspora that are Gambians and they are dentists that are intending to come back home to practice. I'm not sure if we have that situation. So these are all the things that are causing and compounding and increasing the oral health burden in the Gambia. So, and this is what has justified the establishment of the dental school, in which we have homegrown trained Gambians that can help to fill in this gap. So, what are the consequences of this oral disease burden? We have burdens, pain, difficulty in chewing. I have a patient that we managed late last year, and she called me a few days ago, and she's a young woman. She's in her 30s. She has lost all her posterior teeth. Over the years, there's pain. They go somewhere, they take it out. Go somewhere, they uproot it. And they uprooted all her posterior teeth.
Health Day, for celebrating World Oral Health Day today. And I also want to recognize the CMD of this hospital, also my senior colleagues, Dr. George, Dr. Pamela, and also props goes to the president of the UniGaMSA. So my task today is to talk about why we are here. Today we gather to celebrate World Oral Health Day, a day dedicated to raising awareness about the importance of oral health and its impact on our overall well-being. The theme for this year, 2024, a happy mouth is a happy body, couldn't be more apt. If you have experienced toothache before, you can attest to the quote, which I love so much, by Odin Nash. It says, "Some tortures are physical, some are mental, but one that is both is dental." This day serves as a reminder of the critical role that oral health plays in our lives and the significance of maintaining good oral hygiene practices. Oral diseases affect billions of people worldwide, with untreated dental conditions being one of the most common health problems globally. These dental issues, as unimportant as some may perceive it to be, can lead to life-threatening conditions. In this hospital alone, not counting those who have died at home or at the hands of traditional healers, we have experienced 12% mortality rate. That's a 12% death rate over a 5-year period due to patients' delay in seeking dental help. These numbers are significant. By raising awareness through events like the Oral Health Day today, we can address oral health disparities, promote access to dental care, and work towards improving oral health of communities in the Gambia. Healthy teeth and gums are essential for proper nutrition, speech, and self-esteem. Neglecting oral health can result in pain, discomfort, and difficulty in eating and speaking, thereby impacting our quality of life significantly. Some of the consequences can be more severe, causing facial deformities and body deformities, as in the case of a 22-year-old breastfeeding mother whom I had the unpleasant task of removing both rotting breasts due to the spread of infection from her tooth to her chest. The baby's natural source of nutrition during its crucial formative years damaged. The mother psychologically impacted, and dare I say, the doctor psychologically impacted as well. World Oral Health Day emphasizes the importance of preventive care to avoid such consequences. Our oral health is intricately connected to our overall health. Poor oral health can lead to various systemic diseases such as cardiovascular diseases, that is heart diseases, diabetes, and respiratory infections. Poor oral health in pregnancy has been associated with premature and low birth weight babies. By promoting good oral hygiene through simple things like brushing twice a day, flossing, reducing sugar intake, we are not only protecting our teeth and gums, but also safeguarding our general health. As such, a happy mouth is a happy body. World Oral Health Day seeks to start the conversation about oral health. Education is key to promoting oral health practices. By educating ourselves about the importance of brushing, flossing, and regular 6-monthly dental checkups, balanced diet, which will empower us to take control of our oral health and prevent dental issues. Education also seeks to dispel societal misconceptions of oral health in our context, that seeking dental assistance should only be when there is pain. Pregnant women shouldn't visit the dentist. Toothache is spiritual, and that dental care is only for women. I would like to emphasize, no pain doesn't mean no problem. And dental care is for everyone, be it female, male, young, or old. This day allows engagement with communities, schools, and healthcare providers in promoting oral health awareness. It allows organization of events just like we have here today, workshops and campaigns, which can help spread the message of good oral health and encourage people to prioritize their dental health. At an institutional level, it also advocates for policies that support oral health initiatives, increase access to dental care, and also integrate oral health into overall healthcare systems, which is essential for creating substantial improvement in oral health outcomes. And I'm happy to hear today that the CMD said he's going to be more involved and help the dental department also grow. In summary, Oral Health Day serves as a platform to unite individuals, communities, and organizations in a shared mission to prioritize oral health and work towards a world where everyone can enjoy good oral health and overall well-being. Let's commit to taking action, spreading awareness, and advocating for policies that promote oral health for all. Thank you for joining us today in celebrating World Oral Health Day and for your dedication, UniGaMSA, in improving oral health outcomes in the Gambia. Together, we can create a happier world, one smile at a time. Thank you.
So, part of the symptoms of this condition, the first, two of the most important ones, and the ones that we frequently encounter, most especially in our this setting, is toothache, and as well the caries, as the name implies, dental caries is the cavitation. So what happens? This condition, at the initial stage, usually there is no obvious cavitation, but as the process progresses, it leads to obvious cavitations, which are usually with discoloration, sometimes like brown to brown-black discolorations. And as these cavitations progresses towards the pulp, that is when we start to experience severe pain. But then even at the initial stage, we can experience pain from this. But as it progresses without any care given, then it can progress to the pulp, which can cause severe tooth pain that can be sensitive to extreme of temperatures, like in too hot or too cold temperatures, sugary foods, and the like. Third, on the symptoms, we can have halitosis. These are bad breath. And we can see from this halitosis does not only affect you as the patient, but with the people in the society. And nobody wants to be talking to a person whom you know that when talking to the person is a discomfort. So I think it's better that and from looking at everything, it's like the whole thing contributing, the most important thing contributing to this condition is the poor oral hygiene. With poor oral hygiene, that is what leads to the development of plaques. And on these plaques, we have these bacteria. You as a patient frequently being exposed to fermentable carbohydrates, these bacteria tend to act on these carbohydrates, leading to the formation of acids. That's what actually causes the demineralization of the tooth heart structure, leading to the loss of the tooth, leading to cavitations and the like. So the complication of this, one of them is spontaneous pain. Sometimes you can even have a pain that with no trigger. There's no trigger at all. We just, most especially in the cold, during the cold times, we have seen that in the Gambia here, even in our societies. But then what actually happens is at home when we have this thing, all that they tell you is, just go, they will operate it. And it's not like operating is the only solution in this case. There are things that can be done in order to save that teeth. But then if care is not given, if you have not put an importance in this with regards to our oral health and everything, so we see that we end up losing our teeth, as Dr. Dio just mentioned right now. These female that have lost all her posterior teeth, this was as a result of negligence, because it has been there. So obviously we don't have to sit at home until we start having severe pain or we start developing abscess, then we start visiting the hospital. By then it's already too late. So part of the complications, we can have spread of infection, because we know that these are caused by bacteria, and these bacteria, they can travel through the bloodstream. As we know, the part of the bodies are linked, so they can travel through the bloodstream to the heart, other parts of the body. For example, the heart. Once they enter in the heart, what they tend to cause is cardiovascular diseases. Example of them, one of them is endocarditis. As well, they can also travel to the lungs, leading to bacterial pneumonias. They can lead to premature birth and etc. So the most serious complication of this condition actually is death. Before coming to the medical school, I was like, when I see people with these big abscesses, I'll be asking myself, what is the cause of this? But when they tell me it's as a result of tooth pain, or I will be like, no, toothache cannot cause this. But after coming to the clinic here, after coming to this school, after visiting the clinic, that is when I know that actually this is a serious problem in our country, and we need to do something to address it. So the second disease is the periodontal disease. Periodontal disease is a disease of the tissue that holds the teeth in place. Particularly here, we are talking about the gum. So it usually leads to inflammation of the gum, and it's as well a result of poor oral hygiene. Here in this case, what happens? This poor oral hygiene will lead to the accumulation of plaques. But in this case, compared to the dental caries, these plaques are not being metabolized. These plaques do not metabolize the sugars that we take. What happens is when they are left there for a long period of time, they tend to harden, to form calculus. So this calculus tend to spread under the germ lines. So, and at the initial stage of being a plaque, they can be removed by brushing. But then once they have progressed to the stage of being a calculus, only professional cleaning will help to remove these things. So that is why it is also important for us to be visiting the dentist at least twice a year, every 6 months, if not always. So part of the causes, that is the main important cause of this periodontal disease, as I said, is the poor oral hygiene. So it's like poor oral hygiene is a key factor in all of these conditions that we are mentioning here right now. So the symptoms, it affects both the gum and the teeth, because as we said, is the supporting structure of the teeth. So once pathology has occurred in it, then actually it can obviously affect the teeth. So it can lead to gum recession, that is the gum pulling away from the teeth, because we know that at the base of the teeth, from the crown, the dentin at the base there, it has been supported by that gum. So what happens when this infection occurs to the gums tend to pull away from the teeth, from the base of the teeth actually. So once we see that, we know that we are developing periodontal disease. We can also have inflammation of the gum as well. We can have bleeding from the gum. So with the side of the teeth, it can lead to loose teeth, because remember, the teeth is being demineralized. So all these things are key factors. So you have a loose teeth, you can have sensitive teeth, you can have toothache. As well, you can have abscesses. It can lead to abscess formation, recurrent abscesses, and the like. So the third condition, that is oral cancer. So we said oral cancer, they are cancers that originate from the region of the mouth. So they actually tend to affect the lip, the tongue, the gum, the floor of the mouth, or the roof of the mouth. And then it is the commonest head and neck cancers. And the most frequent type that we have in this country is the oral squamous cell carcinoma. As the research have been conducted in this country here, in this main hospital, Edward Francis Moore Teaching Hospital, at the pathology department and the oral diagnosis units. So out of all the biopsied oral and maxillofacial lesions that they collected, they have seen that a majority of the cancers that were diagnosed were oral squamous cell carcinomas. So we can say that these cancers or this condition are existing in the country. So not visiting the dentist or not taking proper care of our mouth is really something that we have to do something about, because it's actually causing a lot. Just from our last clinical these things, we were at the clinic. There, as a young girl, around 20, I think she was 23 to 24 years, she came with this big abscess, and we were like, what is this? So The doctor in charge told us that this is an after show. He told us everything that happens to the lady. But we were like, and at that instant, she could not get the treatment simply because the specialized dentist on that area was not around. So you see, this is the reason why we need Gambians, we need ourselves. Like, the society is in need of us, so we don't have to sit at home and be like acting, or we're just like, it's not necessary, it's not important. But you don't know the importance of it unless and until it happens to you, or you are there in the hospital as a dentist or as a dental assistant. Then you know that these conditions are really important and they are there in this country. So the most common type of these conditions, as I said, is the oral squamous cell carcinoma. Other types also exist, but they are very few, most especially in the Gambia. That is the melanoma and the adenocarcinomas. So, but most of the cause or the risk factors to these conditions, the two most important one, and they are so frequent in our society, that is smoking, tobacco smoking with excessive alcohol consumption. As well, it also have biological etiological agents like Epstein-Barr virus and human papilloma virus. As well, it is also linked with genetics. So complications of this condition, you have difficulty in swallowing, you have speech problem, and you have emotional disruption as well, because we know it's something. Because from the signs or the symptoms, like white and red patches that found all over the lip, the mouth, you can have unexpected weight loss, you can have lump on the neck. So much of these are happening in this society, but because we are sitting at home, we are not taking it important. We don't know that they do exist in the country and they are causing death. So this is all I have for you.
The solution to it is actually embarking on preventions. And as my colleague earlier mentioned, that it's all about when you look at actually the main cause of it is due to what we call poor oral hygiene. So at the end of the day, all the emphasis is actually about the solutions to tackling this poor oral hygiene. So first on this agenda, it would be about the effect of our diet, on oral and dental diseases. So basically, whenever we take carbohydrate-rich diets, you see particularly refined sugar. So whenever we take these refined sugars, chorionic bacteria present actually in the mouth, they actually act on this refined sugar. And whenever they act on this refined sugar, they ferment it, the product of which is an acid. And as we all know, acid is basically corrosive. So what this acid is actually going to do, it is actually going to demineralize the mineralized structures of our tooth. Our tooth is highly mineralized. In fact, one of the is actually the hardest structure that you can actually see in the entire body. So whenever we take these acids, what they tend to do is that they demineralize the mineralized components of our tooth, you see, and at the end of the day, softening the tooth, leading to what we call cavity formations. So it is also very, very, very important that we know the effect of saliva. So saliva produced by our salivary glands takes a minimum of 30 minutes to actually neutralize the acidity of this acid, you see. So thanks to its buffers though. So now you will see that whenever you take a carbohydrate-rich diet, or you take actually a refined sugar, and acid is being produced. So now within that time to the other time, maybe you take another less than 30 minutes or so, you take another carbohydrate-rich diet or refined sugar, you see. So now you will see that saliva will not be able to act effectively to actually neutralize this acidity. So still now the acidity still persists, you see. So, and that tends to actually have more effect actually on our tooth. So you will see that with over time, if you are somebody who actually has this habit, you tend to actually develop cavities and of course signs of dental caries and also periodontal conditions. So now what steps are we going to actually take to ensure that we actually prevent dental caries and periodontal disease, so to speak? So first is dietary modification. We actually need to modify our diet. Everything points to the diet, because there are some factors that are modifiable and some factors are not modifiable. A tooth, the surface of the tooth must be present. A factor is not modifiable. some genetic factors are there. You see? Like, for example, me, I'm not saying that like I perfectly take care of my tooth, but I've never experienced toothache. You see? So there are genetic factors. Like, it depends on the density. At times it depends on the density of your tooth. So the stronger your tooth, you understand, the more immunity you have. It also depends on the saliva that you produce. And all those are natural factors which you cannot actually modify. So what can you modify? The dietary aspect of it. One. So what can we do about that diet? We modify the quality of the diet. In the diet, you have carbohydrates, as we all know, even by medical students, we know that carbohydrate is the largest constituent of our meals, right? Yeah. So therefore, you ensure that you reduce the proportion of carbohydrate in the diet. So by doing that, of course, it means that you are also reducing these acids and fighting against caries. And number two is also the frequency. It is in fact much more toxic, because once you take people like attire, I will just take an example with the attire. You see? So those of us who brew attire, I will not say I'm an exception, because I do sit in a place where we brew attire. You see? So you see that between the force, let's now just say that you have force has been given. So most of the times you see that in less than 30 minutes, second will be given. You see? So now what are you doing now? It is less than 30 minutes before the saliva start acting. You see? So I think so these are things that we actually have to bear in mind. So which means that once we take a carbohydrate-rich diet, or we take actual these refined sugars, we should ensure that we leave a minimum of 30 minutes so that saliva will be able to act and actually neutralize this acidity. So the third thing is also, when we are taking these refined sugars are basically sugars that you have coming from natural sources, like for example sugarcane. So what can we do about these refined sugars? The least you can do is, when you are taking these refined sugars, you take them along with your diet, your meals, so to speak. Normally, you will see that if we are eating also, saliva is produced. So maybe during that time, when you also take these refined sugars, you will see that saliva will tend to neutralize it. So those are solutions to actually this. And my colleague just mentioned about other conditions, dental orificial conditions, so to speak, and we actually have oral cancer. So now, speaking of also oral cancer, what solution can we take towards solving that? Tobacco and alcohol. And in fact, the risk is way dangerous when you take both of them together. It's because they work synergistically well, you see. Though independently, they can actually cause this oral cancer. But the risk is higher if at all you are somebody who smokes tobacco and you are also somebody who consumes alcohol. So therefore, we strongly advise the public, everyone, you see, to quit tobacco smoking and also to quit alcohol consumption. So the next part of this oral health education, it will be a demonstration technique on basically toothbrushing. So before, and we have the model here. This is the model. So we are having the model here and the brush. So I would just like to quickly demonstrate the right technique to brush actually your tooth. So this is how it is. So once you are brushing your tooth, you ensure that it's systematic. It's systematic. Like you take it quadrant by quadrant. You see? Like for example, this half, this side. Now these are the upper teeth, right? So this half is a quadrant. This other half is another side. This half is also another side. This other one is also another side. So that's what we do. And we advise you to use fluoride-containing toothpaste. You see? Fluoride-containing toothpaste. So now first what you actually tend to do is that you dispense your fluoride-containing toothpaste on the bristles of the toothbrush. Let it be a pea size. You understand? It makes no difference if at all you spread it along the whole length of this bristle. It's the same as a pea size. You see? So that's what you do. And now when you do that, the next thing that you can do is now like this. You ensure that you position your toothbrush, the bristle of the toothbrush, so that it is actually horizontal to the tooth. And whenever you position it so that it is actually horizontal to the tooth, then you angulate it. You angulate it around 45 degrees. So once you angulate it around 45 degrees, like this, and you make sure that it comes slightly below the gum line. So now once it comes slightly below the gum line, what you can do now is you swift it. like back and forth, like this, like this, like this. It has to come below the gum line because you are also what we call mobilizing the gums too. You see? So you ensure that you brush all the surfaces of the tooth. You understand? This is the surface of the tooth. This is the side of the tooth. And the chewing areas are also surfaces of the tooth. So ensure that you brush the outer side, as I said, like this, like this, like this. And then you brush also the inner sides. When you also do that, then also for the anterior teeth, like this front teeth that we are having, you also ensure that you also do the same. So once you are brushing the back of this anterior teeth, you ensure that the toe of the bristle is facing it like this. You see? You do that. So now, also, when you look at these molars, the premolars and the molars, you understand? The premolars and the molars, they actually have a chewing surface. You don't have that on the front teeth. They don't have a chewing surface. So therefore, you also come on the chewing surface of the premolars and then the molars, and also you what? You brush it. And lastly, you what? You also don't forget to actually brush your tongue along. So this technique that I have actually demonstrated is called the bars or the sulcular technique. According to a review in 2018, an analysis, systemic analysis, and of course analysis of the various tooth brushing techniques, it was actually found that this technique, the bars or the sulcular technique, is actually the most effective way of reducing plaque and of course gingivitis, which is an inflammation of the gums. So having said that, now there are at times people ask, there are frequently asked questions, for how long should we brush our tooth? You see? So you need to brush your tooth a minimum of 2 minutes. That is the least that you can do. So of course, when you are also doing it, you ensure that you use firm. You use firm but a gentle pressure. Because once actually you don't use, you tend to use, you don't use a firm and a gentle pressure. So the pressure that is actually here, you are exerting a pressure, too much pressure. You are exerting too much pressure on your gums and actually the tooth. And that with time can actually lead to tooth sensitivity and can also irritate actually your gums. So basically, that is actually what I have for you, and I hope you have all learned from it.
Also think what he has said is so simple, and is it practicable? How come so many people are having oral diseases? Yes, they are practicable. Yes, they are practicable, and that's why some of us that have been able to keep to these practices over the years, we have spared ourselves of too much of dental distress. So without wasting time, I would like to recognize the presence of the head of Department of Dental Surgery at the Polyclinic in the person of Dr. Okafor. He came in later on. Thank you, sir, for coming. He's also a great supporter of the dental program. So, without wasting time, I told you I was going to be wearing so many hats. I'm back here again as a presenter, and I'll be talking about the way forward. So we've said a lot about all the problems and all the challenges that may be, and we've also talked about oral health education that is capable of preventing a large percentage of these diseases. Simple: brush your teeth twice daily, last thing before you sleep, floss, come for dental checkup. Simple instructions, they are a lifesaver. So what else can we do to advance oral health? First of all, it will be good for us to define the problem, know that we have a challenge, and make efforts to overcome these challenges, like the inequalities that exist for oral health. For example, socioeconomic factors. This have to do with economy and all that, so that when the economy gets better, more people move up from the low socioeconomic class, and they have access to many more things. So all those things too that are surrounding achievement of good oral health are also attended to. So we must also learn to portray dental issues in a way that inspire others to come and help us. Now, like for some of us in the academic world, now when you submit a grant for a research, and if you are coming your own with oral cancer, or you are coming, how many people? Oral cancer is the most common oral squamous cell carcinoma, most common oral cancer that we see. But by the time people come with tuberculosis, malaria, maternal and child health, they just sweep oral health into the back, and we never get those grants that we need to move forward. But if all of us learn to take oral health along with all these other ones, then we would achieve better results. Also, we must learn to forge alliances with external actors. There are a lot of external bodies that can help us. For example, we have the IADR, that's International Association for Dental Research. They support countries all over the world in conducting dental research. We have none existent in the Gambia. Also, the FDI, which is the World Dental Federation, that are responsible for this Oral Health Day, we need to have an alliance with them. We are hoping that after this program, and after our second phase of program, you get information about the second phase of this World Oral Health Day celebration, that will send reports to them and hope that we can establish a link and relationship with them for them to be able to help us subsequently. And also we have the WHO Global Oral Health Unit also overseeing the oral health for the entire world. Now, if we have alliances with these kind of institutions, then they are able to they can organize high-level meetings at government level. We will not even know about it. They'll just come pay a visit to the president and tell him, look, you need to prioritize oral health. So that also can be done. And we also need to establish institutions that would help us in promoting oral health. I really pray that at the end of this program, that we are able to form a national dental association or something like that, where a collection of dental practitioners can come together and make policies and advocate for better oral health for Gambians. So certain bodies have put up strategies that they've used in other countries, or that they've suggested that could make this to come to be. For example, the WHO had a meeting in Nairobi in 2009, and at the end of that meeting, there was a call for action. First of all, is that a declaration that oral health is a human right and essential to general health and quality of life. So we must treat oral health like a human right, just like every other right that we have. That everybody, we should all have access to basic oral health care. Also, the promotion of oral health and prevention of oral disease must be provided through primary health care and general health promotion. So later on, I'll also talk about, because they had another meeting further down the line, and they said that they postulated that oral health should be practiced like the primary. We have primary health care centers, which are the closest to the populace. So just as we are prioritizing maternal and child health at those primary levels, then we must also be able to prioritize oral health care too. So like some of us have also said about oral cancer, we must address key factors that aid some of these oral diseases. For example, the risk factors like tobacco, smoking, and harmful use of alcohol. Tobacco smoking is responsible for a lot of cancers, not just oral cancer, but it's established that if somebody smokes tobacco for 20-30 years, and assuming is adding alcohol to it, then the likelihood that is going to come down with, I've seen such patients, they come down with oral squamous cell carcinoma later in life. And if it's not oral, they will have lung cancer. If it's not oral, they'll have bladder cancer. So we must also start to address the way we treat tobacco. Then in the 2021 World Health Assembly, World Health Assembly is a branch of WHO that addresses the health of all their member stations and member nations. And they also had a meeting in 2021, and they had some resolutions that oral health should be incorporated into policies for integrated prevention of non-communicable disease. Non-communicable diseases exist, and they are addressed at the primary care level. So we must learn to advocate that oral health care should also be addressed at that level, and we must take measures to achieve that. So also some of the strategies that they suggested were to develop and implement an oral health promotion for school children as part of, there's an aspect of dentistry, community dentistry, that is school health, in which practitioners go to school, because when you catch them at such an early age, then you're able to prevent a lot of diseases. But if at the early age, many of us mothers, we want to placate our children. I just shake my head when I see 2-year-olds early in the morning. They'll go to the shop, they'll go and buy sweets, and they are licking. I just shake my head. How many will I save? How many will I try to save? It is wrong. You could use fruits and things like that to placate them instead of buying them sweets. So, and we see them in the clinics. By the time they come, you see a child with an abscess due to a decayed tooth. So, but we can catch them early from the schools if we advocate and we promote oral health promoting school program. And also we have to scale up capacity to produce oral health personnel. So we are grateful that the undergraduate dentistry program is ongoing. The postgraduate training also will soon be have opportunity to undergo postgraduate training even here in Gambia in dental surgery. So we must learn to we must help to sustain this. And also we should strengthen the medical specialties. A lot of medical specialties, our medical colleagues, this is us and you. It's not just a dental thing. You just see us there, we are struggling and all that. No. Medicine and dentistry exist together. They exist together. So if medicine is making progress, they have to make the same opportunities available for the dental practitioners to make progress. So it's collectively. And why do I say that? Many of us medical practitioners, we see patients, we examine the oral cavity. Oh, we want to check for pallor, we want to check for anemia. Open your mouth. You see bad oral hygiene, you see dental caries, you just turn your eye, or maybe you can't recognize them, and you just want to look for the anemia, and you move on, and leave and ignore all the rotten and decayed teeth in the mouth. So, but with training, we have a lot of medical students come for training come for 2 weeks posting in polyclinic. Then we have community extension workers and nurses that come for training. So these people should make their training show. When you are there, you examine, and the essence is for you to be able to recognize simple dental disease and advise as such, so that we are in this together. You wouldn't see a patient that has a dental complaint and maybe the patient is having trauma or is having some other kind of diseases, and some of those diseases are even linked to oral health. So we must learn to also be to also take part in helping to improve oral health care in the Gambia. We must reduce, we've said that, the intake of sugars. We must also encourage early presentation. Now, we don't wait for everywhere in the world. That's what happens in most places, that people wait until there's pain before we present in the dental clinic. No, we don't have to. 6 monthly appointments. We can advocate for 6 monthly appointments for you to come for a checkup when you are not in pain and you are told that, oh, this needs to be done, that needs to be done. But overall, our task as health professionals, medical, dental, and all our allied fields is giving people health education. It may even be your family members. The knowledge you've gained here today may be for your family members, At least that's what we expect. And when you live here, that you start from your family members. This is what they said. This is how they said. This is how it should be done, So it starts from us. So in conclusion, with the knowledge of the causes and consequences of all these oral diseases we'll be talking about, we should all join hands in educating the general populace on how to prevent oral diseases and encourage them to regularly go for checkup and also follow the advice of qualified healthcare professionals. Thank you for listening. Remember, a happy mouth is a happy body.